The government medical aid scheme has announced an increase to its subscription fee. The medical scheme says the rising cost of healthcare in the country has necessitated this increase. Now, we'll discuss this and continue with this discussion that we had already started with Principal Officer of GEMS, Dr. Stan Moloabi. Doctor, thank you once again for joining us. And you were just about to answer and give us your take in terms of what you think in general are the main contributors of the rising cost of healthcare in South Africa.
Yeah, so healthcare, and I'm going to use this advice that like any commodity, there are inflationary pressures on a year-to-year basis. That's why we know that usually at the beginning of each year, there will be adjustments to various prices, whether it's consumer goods. But in this case, we are talking about healthcare. So the contributing factors, amongst others, are the fact that health professionals who give health services, institutions like hospitals that render healthcare services will adjust their prices due to inflationary issues. That is one of the factors. So it's inflation by and of itself. And then we have that, the population, we have something we call a demographic risk profile of the population that seeks healthcare. So in the instance of medical schemes, that population, depending on how many young people join a medical scheme, that population will have grown by almost a year. So we call it aging. They will have aged by almost a year, but it wouldn't be exactly a year because younger people will pull that down. So an aging population has got a higher burden of disease, which means they are going to seek healthcare much more. And one of the factors is that new health technology, whether it be medicines, whether it be the screening tests that are used by health professionals to diagnose disease, all of those, when they are new, they tend to be much costlier than the previous ones that were already established, which come much cheaper. And then the other thing is that as a result, and this talks to the first point I made, as a result of this burden of disease that is increased, utilization of healthcare services is much higher, and it pushes the prices up.
And I can believe then these are similar factors that have influenced GEMS in this recent decision to increase your subscription fees by 13.4%.
Well, the decision is based on an estimate or a prediction based on actuarial models of what will be the cost of our members for the coming year, which is 2025 in this case. So while there is this focus on the 13.4 that GEMS actually did not, we didn't publish this 13.4, and I'm going to explain why.
Okay.
The reason is that there are variations to what each and every member's increase will be for the coming year. So we chose to write to all our members, calculate their individual increase, and while it aggregates around 13.4, there will be members who will have a slightly higher than 13.4 increase. There will be those who will be right around 13.4. There will be those who will experience even a lower, depending on several factors. And these factors are how many beneficiaries do they have on their medical scheme. So we have the principal member, and then we have the beneficiaries. If you have less beneficiaries, it may be different from the one who has more beneficiaries, because there's also the element of the government subsidy that actually reduces that experience. So one of the things about saying as I said, that we didn't communicate this 13.4, it was communicated by other stakeholders, and we understand why. It's because members will be expecting that they'll calculate the increase once the deduction comes out. And if it's not 13.4, they are going to come to us and say, you said it's 13.4, but mine is 13.5. So what we have done, we have written individual letters to the members to say, in your case, the increase is going to be this amount, and after the subsidy, it will be this amount.
And what's the feedback that you have received from your members with regards to that possibility of that increase or maybe decrease, as you put it?
Well, let's not call it a possibility. It is a reality. And we it was this type of work takes almost the entire preceding year. And when it comes through, and it has an impact on, the pockets of our members, and we understand that. We are very sensitive to that. So at 13.4, it would be, when you look at that percentage, it is high, but it is pushed on by the fact that our members have had a very high utilization ratio for this past year. And based on that, we have to make sure there's provision for their healthcare needs, while we also are doing things to try and stem this trend of a high increase. And one of the biggest contributors is fraud, waste, and abuse. But to answer your question, obviously it hasn't been received well in terms of the feedback that we have been receiving. But we cannot take the risk that we will not be able to cover the costs of the members' healthcare needs in the coming year. We will obviously be doing a lot of work to try and have this trend to reverse. And one of the things is that we do need our members to be part of the solution, in that, as I said, one of the contributors being fraud, waste, and abuse. We need to work on this and really stop it.
So how do rising costs impact the quality of healthcare services, Doc? Are consumers receiving the value for their money in terms of benefits and coverage?
So let me talk about benefits and coverage first. Benefits are based on the option that you choose. And we do have people who advise members. So when you choose an option that you are going to pay for, you look at your ability to pay, but you also look at your state of health. So the more you have chronic conditions, and that would usually be the older members, the more comprehensive type of cover you need. When you are a young person, you do not have a lot of conditions, you use healthcare, your demand for healthcare service is much lower. Then you choose an option that is more on the cheaper side, and then because your need for healthcare costs, healthcare services is much, much less. So those are the variabilities that come into how you choose an option, and that will then determine what you are going to pay for a medical scheme in the coming year.
How does the regulatory environment within our country affect the pricing and the operation of medical aid schemes?
Well, the regulator has to ensure that each and every scheme, when it prices for the coming year, it does so adequately. So the process involves us as a medical scheme. We will work out, as I said, it's a process that starts very early in the year. From February, we are already looking at what are the things we need to attend to for the coming year. So we then are obliged, in terms of the Medical Schemes Act, to submit our business plan or our estimates for the following year by the end of September. And then the regulator will then look into our plans. They have also actuarial expertise. They will look at what we have submitted. And if you are underpriced, they will not approve your business plan for the coming year. Or if you seem to be overpricing, they will also not approve. They will engage with the medical scheme and say, our actuarial analysis does not agree. So when we ultimately submit and have this approved, both the medical scheme and the regulator would have looked at the estimated costs for the coming year, which determined the contribution increase that the medical scheme is proposing for the coming year. If they do not approve, you cannot go ahead with it. So in our case, I think having considered our utilization and all the other factors, that increase that we determined for our members was also approved by the regulator before we actually, by the time we wrote to our members.
So you mentioned a demographic risk profile and an aging population that gives rise to the prices of medical aids. What role does preventative care play in managing healthcare costs? How can promoting preventative health measures and just reducing the financial burden on medical aid schemes assist?
It's so crucial. It's the most crucial thing that would save medical schemes and the health funding industry a lot of money. So if a person does not take care of, if you don't screen, let me use an easy example, and I think it's been topical. If you don't screen young females for a human papilloma virus, you would have those that get the virus, they are predisposed to cervical cancer. So your cost, while by the time they get cervical cancer, is very phenomenal. Even the cost to, just quality of life, it's phenomenal. If there had been screening and vaccination of HPV, you would reduce the prevalence of cervical cancer by a very, very big percentage. So it's a very good example of if you do the primary healthcare things properly, they can prevent those secondary illnesses that actually can be very costly. So in a nutshell, primary healthcare, preventative care, screening for health early in life, these are very, very important components of reducing healthcare costs ultimately.
Lastly, Doc, how will NHI affect medical aid costs in the long run?
Absolutely don't have, what do you call it, a crystal ball, to can determine that one. However, the reason why NHI is, being implemented in South Africa, despite all the challenges that we all know about, that, there's still a long way to go. NHI is aimed at one thing, to achieve universal healthcare coverage. And universal healthcare coverage simply means that you should have access to quality healthcare, irrespective of your ability, to pay. This, in essence, means that everybody should have access to this. And as you can hear, it is very ideal. A lot of work still is to be done. But in terms of the costing, now, when you're talking about costing, how will it affect the costing into the future? Cost of healthcare, it's a multiple of factors. It's whether, what type of healthcare services people are getting access to. It is the prices, whether they are negotiated or prices have just been left to market forces. These are the things that national health insurance, as it is envisaged, is aimed at solving in South Africa. But there's still a lot of work that, as we know, still needs to be done in terms of the cost of an NHI. So I don't think anybody has got the answer to your question at the moment.
Your crystal ball still has a lot of work to do, Dr. Moloabi. Thank you so much for your time and for joining us this afternoon, just giving us a take there with regards to the government medical aid scheme and the possible increases and decreases that members will get to feel in the coming year.